My name is Regina Eggink, and I'm from the Netherlands. And I come in South Africa twice a year, and I come here with a mission. Because that is also my story. What I give to you, never give up the goal that you want to achieve. Because you can go right or you can go left, but you always will come at that point. And that is the lessons that I learned from Harold Robles. He was the founder of our organization, and on request of Desmond Tutu, he started health education in the townships, because health education is a human right. Together with Dr. Jelle Braaksma, he started health education in the township to prevent people from unnecessary dying. So wash your hands before you are going to cook, knowing what obesity is, knowing what a good health is. We have the Health Promoters South Africa Trust in South Africa, and we have the Friends in the Health Promoters in the Netherlands. The money is coming from the Netherlands. We are approaching funders to get the money, and also organizing golf tournaments to get the money for our organization in South Africa. Every year we have a golf event, and that's a huge one. Unfortunately, Harold passed away in 2020, and that was enormous. It was a very difficult time, I must say. One of the most difficult years of my life. Everybody thought that our doors would be closed in the Netherlands and also in South Africa. But George and I, George is the CEO of South Africa, we kept on going because we believed that this organization can go on. Also, Corona came, so we could not organize events. Foundations had difficulties with the money. So we never, in that time, we really thought, how long will we survive? But here we are, still standing strong, and 4 years later. We are active in 4 townships, Payamandi, Kailicha, Langa, and Mofulini. And this year we hope to also start in Idos Valley and also in Strand to give health education to the people. COVID put us on the map because everybody knows that hygiene is very necessary to take care of. And we now are in 4 townships and almost 6 townships, but we have waiting lists. Before Corona, we had to flyer get everybody on board, and now we have waiting lists. In 2022, we had a waiting list for 4,000 people, all want health education. Why? Because our certificates give people jobs. If you know how to handle hygiene, then you can work in a hospice, or in a hospital, or in a restaurant. So that is our luck. And now we decided in 2022, health education is free of charge. But when you want a certificate, you have to pay 150 rand. And that's an amount that everybody can pay in the township. Because it's also a positive feeling when you also invest in your education. And the people of the township wants to pay that. After 5 weeks, health education, you take a test, and if you succeed, then you will get your certificate. We celebrate it with a graduation. People get gowns and are wearing it with pride. They never had thought that they ever would wear a gown. So also there is singing, dancing with that ceremony, but also tears of joy. They can see they can change their own world, their own life, by getting a job with our certificate. And every time we have a ceremony, we also ask somebody who tells their story about what happened after our education. The lady who's coming now, yeah. She's a nurse now, and she tells everybody in our ceremony, our clients, that they have to go on. Don't give up. Don't give up. Go on. We are active with 2 boards, one in South Africa and one in the Netherlands. And what we are going to put in our curriculum is also mental health. And mental health is very important in the world nowadays, because in all the world we have the problems with mental health. And also we are working on a database to put companies and our clients together, so companies know that when they have clients of us, they know they have people who want to work. This is my team in the Netherlands after a golf event. And we are working now to become international, not only in South Africa, but we're also active in Lesotho now. And this week we were in Lesotho to open a location at Scott Hospital. They were very enthusiastic. We're going to start with mental health and basic health there. And this week we were invited by the Queen of Lesotho to talk about our program. And they see there's a solution for the poor people to health education is a human right. So that's where we are now. And I never thought that we would come here. And 4 years ago, we were looking for money to survive the next month. And now we are sitting here with Lesotho, with the Queen of Lesotho, to have a plan for the future. So I'm very thankful for that, and that's my story. Thank you very much.